Hi, my name is Tatum Eccles, and I'm going to be doing the head-to-toe assessment on my partner, Riley Emerson. So first thing I'm going to do is gel in and ask for your name, date of birth, and any allergies.
My name is Riley Emerson. My birthday is 11/10/99, and I have no allergies.
All right. So I'm going to start with the cardiac assessment. So first thing I'm going to do is listen to the heart in the 5 locations. If I can get my stethoscope on. So I'm listening with the diaphragm of my stethoscope first, and I'm going to listen on the right side, second intercostal space for the aortic. And then I would move to the left side, second intercostal space for the pulmonic. Left side, third intercostal space for Erb's point. Left side, fourth intercostal space for tricuspid. And then could you lift your breast, please? And then I'm going to listen here for at the left side, fifth intercostal space for the mitral. Then I'm going to turn to the bell side of my stethoscope and do that again. So right side, second intercostal space for the aortic. Left side, second intercostal space for the pulmonic. Left side, third intercostal space for the Erb's point. Left side, fourth intercostal space for the tricuspid, and then, thank you, left side fifth intercostal space for the mitral. So I did not hear any clicks, gallops, or murmurs. Now I'm going to, and her pulse was 98 beats per minute. So now I'm going to have you lay down, please. And she's at a 30-degree angle, so I'm going to look at her neck for jugular vein distension, and I do not see any. So now I'm going to use my stethoscope, the bell side, to listen for any bruits, and no bruits were heard on either side. So now I'm going to check I'm going to feel for thrills first. So I'm going to feel for thrills. I don't feel any thrills, so now I'm going to check all of her pulses, starting with the temporal, and then I'm going to feel the carotid one at a time. I'm going to feel the brachial, the radial, and the ulnar, and then the femoral, and then this side, thank you. And then if you can flip over, I'm going to check the popliteal pulse. Then the other side. Okey-dokey, if you could turn over one more time, thank you. I'm going to check the dorsal pedis, and then the posterior tibialis. Okay. And all pulses were felt bilaterally symmetrical with a grade of 2+. Now I'm going to check capillary refill. Capillary refill is less than 2 seconds on the fingers and toes. Her skin is warm to the touch. There's no edema, and she has even hair distribution from her ankle to above her knee, and from her wrist to above her elbow. And I believe that concludes my cardiac assessment. So now I'm going to move on to respiratory. If you could sit up for me. First thing I'm going to look at is there's no obvious signs of respiratory distress. There's no cyanosis around her mouth. Her posture is upright and relaxed. Her chest expands with inspiration and contracts with, chest expands with inspiration and contracts with expiration. Her chest is ovoid in shape, and her lateral diameter is twice the length of her AP diameter. Now I'm going to listen to her lungs in the 5 lobes, starting with the right upper lobe, left upper lobe, right lower lobe, and left lower lobe. Then I'm going to come to the side and listen to the right middle lobe. And all of her lung sounds were clear with no adventitious breath sounds. She's not using any accessory muscles to breathe. So then I'm going to follow her scapula on her back and listen in 6 locations. And I'm going to compare these bilaterally. And all of these sounds were heard bilaterally symmetric. Her lung sounds were clear. Now I'm going to check capillary refill. Capillary refill is less than 2 seconds, and I believe that concludes my respiratory assessment. I'm going to move on to abdomen. Actually, no. That concludes my respiratory assessment for now. I may come back to that in a couple minutes. I'm going to move on to the abdomen. So if I could have you lay down, please. Okay. So the abdomen is tan with pink undertones. It's slightly paler than her arms. There is, could you hold your breath for me? There is a slight visible aortic pulsation. So I've inspected. Now I'm going to auscultate. So put on my stethoscope again, and I'm going to listen in all 4 quadrants. Okay, so in each quadrant there were 5 to 35 sounds per minute, which was within normal range. Now I'm going to palpate lightly. So light palpation is 1 to 2 centimeters. And then I'm going to palpate deep, which is 4 to 6 centimeters. Are you experiencing any tenderness? Okay, there was no masses, tenderness, or crepitus felt. So now I'm going to palpate the umbilical ring. The umbilical ring is intact. There was no bulges or hernias felt. Did you experience any tenderness? No? Okay, so you can pull down your shirt. Sorry.
Okay.
Okay, and then stand up, please, and I'm going to check for costoventricular angle tenderness. So tell me if this hurts. No? Okay, so she doesn't have any tenderness in her costoventricular angle, so her kidneys are okay. Back to respiratory. Her muscle development is even and bilaterally symmetric. I'm going to palpate. Are you sore anywhere? Okay, can I feel your back, please? Okay, thank you. And then I'm also going to feel for thoracic expansion. All right, so her ribs do expand when she inspirates. Inspirates? When she breathes in. So that was cardiovascular, respiratory, and abdomen. So now I'm going to move on to integumentary. Also for respiratory, her costal angle is less than 90 degrees. So you can go ahead and sit. Integumentary, I'm going to be looking at hair, skin, and nails. So I'm going to start with her hair. Her hair is brown, it is clean, it's non-chemically treated, and there is no evidence of dandruff or pest inhabitants. I'm going to feel your scalp. There are no masses and there are no lesions. That's her hair. Her body hair is evenly distributed from above her elbow to her wrist. And I'm going to look at your legs really quick. And from her ankles to above her knee. So that's all of her hair. Her skin is tan with pink undertones. It's warm. There are no lesions. Her capillary refill is less than 2 seconds. Her nails are well adhered. They're round. There's no ridges, and they are a convex shape, and they're clean. And her hair on her face is a regular pattern female hair distribution. That includes our integumentary. We went over hair, skin, and nails. Now we are going to do head and neck. So let's start with neck range of motion. If you could look up for me, and then down, and then to the left, and then to your right, and then try to shoot your true shoulder, both sides. Okay, so she has full neck range of motion. I'm going to feel your head. Her head does not have any masses or lesions on it. It is bilaterally symmetric and it is appropriately sized for her body. Her head is midline to her neck and her neck is midline to her shoulders. The muscle development is even. Her trachea appears to be midline. And what else? Your head is there, your neck. If you could swallow, please. Okay, the thyroid moves freely up and down when she swallows. So now I'm going to feel the lymph nodes. We're going to feel the preauricular, postauricular, tonsillary, submandibular, submental, and sublingual. And then the anterior superficial cervical chain. Did you experience any tenderness? Okay, so the lymph nodes were non-palpable, non-tender, and not swollen. So, That concludes our head and neck. And then I'm going to move on to the eyes. So we previously tested her vision with the the Rosenbaum for distance. No, Snellen for far distance and Rosenbaum for close distance. On the Snellen, she scored 20/20, non-corrected, and on the Rosenbaum for close distance, she scored 20/20, non-corrected. Now I'm going to test your peripheral vision, so just tell me when you can see my fingers.
Yeah.
Okay, her peripheral vision is intact at 180 degrees. And then we're going to check the 6 cardinal fields of gaze, so if you just follow my finger. Okay, her eyes were able to track my finger smoothly with no signs of nystagmus. And that's all of the test for the eyes. So now we're just going to look at the eyes. They are bilaterally symmetric. Her eyebrows are above the eyes. The top eyelash is curled up and away, and the bottom eyelash is curled down. The sclera of the eyes are white and clear. I'm going to pull down your eye. The conjunctiva and the lacrimal puncta of the eye are pink and clear of any discharge. The irises are green, and her pupils are about 5 millimeters in size. And so now I'm going to check Perla. So I'm going to shine this light in your eye for just a second. Okay, the pupils constrict with light, and they both constrict at the same time, so there's consensual response. And then if you could look at my finger and then look at the wall and my finger. Okay, so her pupils constrict for close vision and dilate for far vision or distance, and so there is accommodation. Her pupils are equal, they are round, they react to light, they accommodate, and I believe, I'm going to look at the side of the eye to make sure the cornea is clear and there is adequate space in the anterior chamber, and I believe that concludes our eye assessment. So now I'm going to move on to nose, mouth, and throat. So her nose is midline to her face. It is bilaterally symmetric. The septum is midline to the nose and it is intact. If you could cover one nostril and breathe in. And then the other side. Okay, so the nares are patent. There is no excessive discharge and there's a little bit of hair in each nostril. The philtrum is midline to the nose. Her lips are pink, moist, intact, and free of any lesions. Alright, now I'm going to look inside your mouth. So her tongue is pink, it is bilaterally symmetric. Underneath the tongue is vascularized, there's free of lesions. Her buccal mucosa is pink and intact with no lesions. I'm going to look at your tonsils. Her tonsils are there, but they are small and flat with a grade of 1+. If you could say "ah" for me. Okay, the soft palate and the uvula raised with vocalization. The uvula is bilaterally symmetric, pink and moist. The soft palate is mobile, pink and moist, and the hard palate is dome-shaped with some ridges, and it is immobile. Excuse me. Her teeth are aligned, top over bottom. They're white. All 36 are present. There are no caries, and they are hygienic. Her gums are well adhered to the teeth. They're pink, they're moist, and they are non-swollen. Excuse me, I'm sorry. My throat is getting tickly. Okay, so that concludes our nose, mouth, and throat. We've done eyes, so now we can do ears. So starting with the ears, we're going to do the Weber test. Tell me if you hear this equally.
Yes.
Okay, so she was able to hear the Weber test equaling both ears, so there's no signs of lateralization. Now we're going to do the Rhine test. Tell me when you can't hear this anymore.
No. Yes. Yes.
Okay, now we're going to do that on the other side.
Yes.
air conduction was twice as long for bone conduction on the Ryan test. Now we are going to do the finger rub test, so tell me which side you hear my fingers on.
Right, left, right. Backwards.
Okay, so she was able to identify 100% of the finger rub test. Now we're going to do the whisper word test. So I'm going to say 3 words and you can tell them back to me.
Red, green, blue.
Okay?
Pink, purple, yellow.
Perfect. So she was able to identify 100% of the words from the whisper word test. So now I'm just going to examine the ear. The ear is tan with pink undertones. It is C-shaped. The ears are bilaterally symmetric. There's no lesions or excessive discharge. The ear is about 5 centimeters in length and it is 10 degrees from horizontal. Excuse me. And the pinna of the ear is aligned with the outer canthus of the eye. And I believe that concludes our ear assessment. So we've done nose, mouth, and throat, eyes, ears. Now we're going to move on to musculoskeletal. So if you could, I'll go this way and you can go that way. If you could walk towards me. Okay, so her gait is steady and even and there is no gross deformities. Musculoskeletal. So we're going to check range of motion. So we've already tested neck range of motion. She has full range of motion of the neck. If you could swing your arm forward, backward, and then bring it up. Wiggle your wrist and your fingers. Alright, and then the other side, backward, forward, up, wrist, fingers. Okay, so she has full active range of motion of the upper extremities. We're going to check axial skeletal range of motion, so if you could lean to the side and twist at the same time.
Yeah.
No. So she has full range of motion of the axial skeleton. Now I'm going to check for scoliosis. If you could bend over, I'm going to feel your spine. Okay, there's no signs of scoliosis in the spine. Looking at her, her muscle development is bilaterally symmetric through the shoulders, hips, knees, and ankles, and same with the back. Muscle development is bilaterally symmetric through the shoulders, hips, knees, and ankles. So we've done range of motion. So now let's do active range of motion in the legs. If you could kick your legs forward and back, out to the side, and then bring your knee up and out. Okay, and then do that on the other side. Out, up, and out. So she has full range of motion of the lower extremities, full active range of motion. If you could duck walk towards me. There's room, sorry.
It's okay.
Okay, so she's able to duck walk, so that means that there is structural stability in her hips, knees, and ankles. If you could wiggle your ankles and your toes. Okay, and then wiggle your ankles and your toes. Alright. I think you can go ahead and have a seat. And we will do active range of motion, or passive range of motion. Range of motion is always what gets me. Alright. So, I'm going to start with your shoulder. And I'm going to wiggle it. I'm going to wiggle your elbow, your wrist, and your fingers. And I'm going to come to the other side. And move your shoulder, your elbow, your wrist, and your fingers. There's full passive range of motion in the upper extremities. So now I'm going to lift up your leg and pull it out to the side. And check your knee and your hips, and your ankles, and your toes. And I'll gel in. Okay. Then we're going to do this side. Bring it up and out. Bring the knee up and out. And then wiggle your ankle and your toes. All of them. So she has full passive range of motion of her upper and lower extremities. So now we are going to test strength. Sit up and then push against my hands. This side, backward, forward. Alright, push against my hands. This way, side. Push down. There we go. Up. push up. On this side, I'm gonna move this. Sorry. Okay, push out. This side. All right, push up. And then push down. Okay. So, she has full strength of her body, 5x5 contralaterally. And I believe that concludes our musculoskeletal. Yes. So now we're gonna move on to neurologic. Let me grab a drink really quick. Oh my goodness. Okay. So now we're gonna move on to neurological. So we're gonna start with, if you can stand up and walk. Okay, so she has no gross deformities of her, not gross deformities, she has gross motor function of her lower extremities. We start with cranial nerve 1, which is the nose, so you can go ahead and have a seat again. And if you could close your eyes and then tell me, cover one nostril, and tell me what you smell.
Hand sanitizer.
Okay. And then we're going to do the same thing with the other side.
Peanut butter.
Okay, so her cranial nerve 1 is intact as she was able to identify the different smells. Now we're going to test cranial nerve 2, which is the eyes. We've previously tested with the Snellen and Rosenbaum test, and she scored 20/20 uncorrected. So now I'm going to look at the peripheral vision. Tell me when you can see my finger.
Yeah.
Alright, so her peripheral vision is intact at 180 degrees. Snellen, Rosenbaum, peripheral. So now we're going to test cranial nerves 3, 4, and 6. So we're going to do that with the cardinal fields of gaze. Follow my finger. Okay, her eyes were able to track my finger with no signs of nystagmus. So now we're going to move on to cranial nerve 5. So I'm going to try to open your jaw and don't let me. Okay, so she has full jaw strength. I'm going to use a Q-tip and tell me where you feel it on your face, okay? Oh wait, close your eyes. No problem. Okay, so her facial sensory is intact with cranial nerve 5. Now we're going to test cranial nerve 7. So if you could smile, and then smile without teeth, and then frown, and then raise your eyebrows, and puff out your cheeks. Okay, cranial nerve 7 is intact. Cranial nerve 8 is the ears. So we're going to do the Weber test again. Tell me if you can hear this on both sides or only one side.
Okay. It's both sides.
Okay, so there's no lateralization with the Weber test. The Rhyme test, tell me when you can't hear it anymore, okay?
Okay. Okay. Okay.
Okay, so now we're going to do that on the other side.
Okay. Okay.
Okay, so with the Rhyme test, the air conduction was twice as long as the bone conduction. Now we're going to do the finger rub test and the whisper word test. So tell me which side you hear this on.
Right. Left.
Okay. Now I'm going to whisper 3 things and you can tell me what you hear.
Red, blue, green.
Alright.
Purple, green, orange.
Okay, she was able to identify 100% of the whisper word test. So her cranial nerve 8 is intact. We did Weber, Rhyme, whisper word, and finger rub. Yeah, that's everything. Okay. So then we're going to move on to cranial nerves 9 and 10. So if you could swallow for me. Okay, so her gag reflex is intact. And then I'm going to look. You could say Okay, the soft palate and uvula move when she talks. So cranial nerves 9 and 10 are intact. Now we're going to test cranial nerve 11. If you could push against my hand. Okay, cranial nerve 11 is intact as she has full strength of her head and neck. And then cranial nerve 12, if you could stick out your tongue and then put it to the side and the other side. Okay, she has full range of motion every time. You could press on my fingers. Alright, cranial nerve 12 is intact. So now we're going to test reflexes. So I'm going to test the radial ulnar reflex, brachial reflex. Alright. Thank you. Okay, now we're going to check the patellar reflex. Alright, so all of her reflexes are fully intact with a grade of 2+. Now we're going to do the romper test. So if you could stand up, put your arms out, and keep your eyes closed. Okay, and she doesn't fall over, so she has balance. What else? Now we're going to check fine motor skills of the lower extremities. So if you could put your heel to your shin, bring it up. You can do that on both sides. So she has fine and gross motor skills of her lower extremities. If you could pat your legs and alternate your hands, and then go faster. Okay, so she has gross motor skills of her upper extremities, and then if you could touch your fingers. Alright, so she has fine motor skills of her upper extremities. Let me just think for a second. I think that concludes our we're going to check sensory. Okay, so we're going to do this with sharp versus dull. Tell me what you feel. This is dull and this is sharp, okay?
Okay.
Alright.
Dull. Sharp. Dull. Ooh. Sharp. Dull.
Okay, so her sensory is intact. She was able to identify 100% of sharp versus dull. And I think that concludes our head-to-toe assessment.